Over time, you want to make some improvements to your face or body. The starting point is to go on the internet or visit a local plastic surgeon to check for prices. And soon you will find out that the prices in the United States are very high. The normal reaction is to check for prices in other countries. And you will soon find out that Costa Rica is one of the #1 medical tourism destinations. Costa Rica is beautiful, is safe, and have very good doctors. Now we will start with the tips for plastic surgery in Costa Rica. Tip number 1. Things to be considered when setting up your budget. There are 3 things that need to be considered for setting up your budget. Number 1, the cost of the procedure. Usually everything is included in this price. When I say everything, I am talking about the surgery team, the OR, the anesthesiologist, the pre-op and follow-up appointments. Sometimes lab tests and medicines are extra. That is something that you need to ask your plastic surgeon. Number 2, the cost of the airline ticket. It's just a matter of you going online and finding out what is the price. Many of the round-trip tickets to Costa Rica have very low rates. Number 3, the cost of the surgery recovery in. You need to ask your plastic surgeon how many days you need to stay in Costa Rica and then contact your surgery recovery in and get a daily rate and add things up, and also make sure what is included in the rate. What will you need? If you will need transportation, if you will need nurse, if it has the 3 meals included, all of that is important when you are setting up your budget. Tip number 2, choose carefully your plastic surgeon. Check the credentials and the experience that the plastic surgeon has in that particular procedure that you want. Look for before and after pictures and also check patient testimonials. Since you are not able to have a physical consultation with your plastic surgeon, it will be a good idea if you can set up a video consultation with your plastic surgeon and have a first face-to-face meeting with your plastic surgeon and see how you feel about it. Tip number 3, make the payment of the surgery before you travel if possible. It is more convenient than carrying a lot of money. Follow the doctor's instructions on how to pay for your surgery and ask carefully what covers. For example, if it covers the surgery team, the OR, the EKG, lab tests, mammogram if you need it, garments, post-op medications, and massages. These extras will add up to your expenses, and that way you can budget accordingly. Bring some cash with you in case you have to pay for these extras, because the use of a credit card in Costa Rica is a 5% extra. Also, ask your doctor if they give some discount for paying with cash, and then it is up to you if you want to pay cash to get the discount. Tip number 4, what to do if the lab test, EKG or mammogram are not included in my price. If the pre-op lab test, EKG or mammogram are not included in the price, you can bring them from home. The pre-op lab test can be done 1 month prior to surgery. If it is an EKG, it can also be done 1 month prior to surgery, and you have to make sure to bring the cardiologist's written report along with the EKG graph. The average cost in Costa Rica for an EKG is $90. In the case of the breast ultrasound or mammogram, it can be done 1 year prior to surgery, and you also have to bring the doctor's written report. And the average cost in Costa Rica is $60. Tip number 5, do's and don'ts prior to surgery. Let me start with the do's. If you are having liposuction, you can start taking iron supplements approximately 30 days prior to surgery. If you decide to take iron supplements, it's possible that you will recover quicker and feel more energetic afterwards. It's also recommended to take extra vitamin C prior to surgery to assist you with healing. Exercise is also important before surgery, but do not overdo it. Now let me go with the don'ts. Stop taking aspirin or any kind of medication containing aspirin because this is a blood thinner and it interferes with blood clotting and healing. Another thing is to stop vitamin E and natural medicines such as garlic, arnica, or ginseng 2 weeks prior to surgery. No Accutane 10 days prior to surgery. If you smoke, it is highly recommended that you stop smoking 4 weeks prior to surgery, but no later than 1 to 2 weeks prior to surgery. And also, do not go on strict diets before surgery because you need to be healthy and strong for recovery. Please keep in mind that I'm not giving you any kind of medical advice. I'm just giving you general tips from the knowledge that I have. For specific medical questions, it's better that you write to your plastic surgeon in Costa Rica and get all these things cleared up. Also, keep in mind, and I want to tell you that I have a more detailed list of supplements. There is a lot of supplements that you can and you cannot take, but I cannot mention in this video because I'll make it way too long. So feel free to ask me in the comment section below and I will guide you and give you all the specific list that I have of these supplements that you can and that you cannot take. Please continue watching my videos because I'm going into the part 2 on the tips on how to prepare for traveling for plastic surgery to Costa Rica. I'll see you in my next video.